Why does adamantinoma, bone cancer local recurrence happen? Imagine a slow-moving but persistent problem that can come back years after treatment. That's what happens with adamantinoma, a rare type of bone tumor that mainly affects the shinbone. It's usually low-grade, meaning it grows slowly and isn't highly aggressive, but it can still recur locally. The main reason for this is often related to how the tumor was initially removed. If the surgery didn't remove all of the tumor tissue, residual tumor cells can remain. These leftover cells can slowly grow back, causing the tumor to return at the same site. This is why surgeons aim for what's called en bloc resection, removing the tumor along with a margin of healthy tissue around it. Having clear, wide margins reduces the chance that any tumor cells are left behind. Sometimes, the initial treatment might only involve a biopsy, which confirms the diagnosis but doesn't remove the tumor completely. If the surgical margins are narrow or positive, meaning tumor cells are found at the edge of the removed tissue, the risk of recurrence increases significantly. The type of adamantinoma also matters. Certain histological variants, like basiloid or spindle cell types, tend to behave more aggressively, making complete removal even more crucial. Because these tumors can be quite heterogeneous, with some parts harder to detect, there's a chance that some tumor tissue might be missed during surgery. Another factor is the slow-growing nature of the tumor. It can take many years for a recurrence to appear, sometimes more than a decade after the initial treatment. This long latency period highlights the importance of ongoing, long-term monitoring after surgery. Regular follow-up scans help catch any early signs of recurrence so that treatment can be started promptly. In summary, the main reasons for local recurrence of adamantinoma are incomplete surgical removal, narrow or positive margins, more aggressive tumor subtypes, diagnostic challenges due to tumor heterogeneity, and the tumor's slow growth pattern. To reduce the risk of recurrence, the best approach is wide surgical removal with clear margins, thorough pathological assessment, including special tests to identify all tumor components, and consistent long-term follow-up. It's important to remember that neither radiation nor chemotherapy has been shown to be effective in preventing recurrence in adamantinoma. The key is careful surgical planning and ongoing surveillance, always under the guidance of experienced medical professionals. If you or someone you know is dealing with this condition, consulting a specialized orthopedic oncologist is essential for personalized care and the best possible outcome.